because people just feel you have headache, you have bitter taste in the mouth, you are feeling dizzy. The next thing is for you to jump into a community pharmacy or a pattern medicine shop and then prescribe yourself anti-malaria, and then you start taking. For the fact that you have headache, bitter taste, dizziness does not tell you that you're having a malaria infection, for instance, and then you are now prescribe yourself. So that's why a lot of people are coming down with resistant strains of malaria.
Hello, welcome to Vital D, where we provide you with the latest information to stay healthy and educated. I am your host, Etimbu Ben, and I'm here with my partner, Fam David.
Hello there.
Welcome, Fam David.
Thank you so much for having me.
How was your day?
Thank God, we are doing well.
How is work?
Yeah, we are still pushing and we are hoping for the very best.
All right. In today's episodes, we are going to talk about drugs resistance. How does it affect you? How does it affect your family? How does it affect your health? Fam David is going to tell us everything we need to know about drugs resistance. So, Fam David, can you please explain in a layman's knowledge what is drug resistance?
Okay. Thank you once again for having me.
You're welcome.
You know, drug resistance is a growing concern in the society that we need to be aware of. So, in a layman's term, I would say drug resistance occurs when disease-causing organisms such as bacteria, virus, fungi, or parasite evolves and become resistant to a particular medication that was designed or that was made to kill them or inhibit their growth. Now, once these medications or once this drug molecule that was designed to kill them or inhibit their growth fails to do that, there is drug resistance. So that is a layman's term that anybody can understand what drug resistance is all about.
Okay, Fam David. So how does this drug resistance develop? What causes it? How does it start?
Well, a lot of factors could give rise to the development of drug resistance.
Okay.
But I will talk about the obvious ones and then the ones that we don't even know about. But you know, the most popular and the common one is the misuse and overuse of antibiotics or drugs. For example, now, once an individual or a patient uses a particular drug molecule or antibiotics excessively, what it does is that it does not only kill the bad microorganisms, the harmful ones,
Right.
it could also destroy the beneficial microorganisms in the body. Now, once that happens, some part of the body can develop immune. Those microbial organisms can develop immunity to that drugs in the future. So once that occurs, there is development of drug resistance. Also, another factor that could cause that is incomplete regimen plan. You know, some of us, which is what a lot of us are victim of, use a particular antibiotics, for example, without finishing the course. For example, we are on a particular medication for antibiotics course for maybe a period of 10 days. And then you started using that particular antibiotics, and after 5 days, you felt relieved. Now you stop that particular antibiotics. What you have done is that some part of that microorganism that has been partially exposed to that drug that you have used will start to develop resistance to that drugs in the nearest future. So you should always complete your regimen plan. Then another factor, genetic factors could also give rise to development of drug resistance. Then another one that is becoming so alarming is the use of antimicrobial agent in our farm produce. You know, most of those things can develop resistance and can be transmitted to human through either a contact, could also be through in which we eat contaminated food, or even through the use of can be transmitted through the use of contaminated food or contaminated meat, as the case may be, or this meat that we ate from this animal farm produce were not properly cooked. So that could also expose us to drug resistance. Genetic factors could also expose us to drug resistance. Then environmental factors could also expose one to drug resistance. For example, from environment that they have pharmaceutical companies and they empty most of those waste products into a sea or ocean around you. Now a lot of microbes could harbor and then become resistant to that particular thing, and maybe you are from such environment and those water is what you are consuming. It could also expose you to drug resistance. So with that said, a lot of factors could give rise to development of drug resistance. Like I mentioned earlier, the misuse and overuse of a particular drug, then not completing your treatment plan, genetic factors, environmental factors, and even the use of antimicrobial agent in our farm produce could expose one to development of drug resistance.
Thank you very much, Bam David. So, what is this impact of this drug resistance on health? How does it affect health?
It's a growing concern on our health. You know, for example, people that are meant to be in a course of treatment for a period of 5 days will end up spending 2 weeks in the hospital. So it also increasing the mortality rate. That means the people of dying as a result of drug resistance is on the increase. And also making treatment costs to be very expensive, and also making most of those drugs that are supposed to be for a particular conditions is becoming less accessible to the public because of how scarce it is to get or to come by in order to treat a particular condition.
Okay, thank you very much. So, what are the real examples of diseases that causes drug resistance?
A lot of diseases can give rise to development of drug resistance, but I will start with the common one that is very common to us here in our society, Nigeria, as a case study. Malaria, for example. There are a lot of anti-malaria resistance out there because people just feel you have headache, you have bitter taste in the mouth, you are feeling dizzy. The next thing is for you to jump into a community pharmacy or a patent medicine shop and then prescribe yourself anti-malaria, and then you start taking. For the fact that you have headache, bitter taste, dizziness does not tell you that you're having a malaria infection, for instance, and then you are now prescribe yourself. So that's why a lot of people are coming down with resistant strains of malaria. The another one that is becoming so alarming lately is a urinary tract infection. It's becoming very difficult to treat lately because of the development of drug resistance associated with it. They will also have tuberculosis. There are a lot of resistant strain of tuberculosis that give rise to multiple drug resistance. Those are the major ones, but that does not mean these are the only ones. There are a lot. I'm just giving you these three for you to know that even the ones we don't know or can also give rise to drug resistance.
Okay, thank you. So does the doctors, does the health professionals, do they have a hand in causing drug resistance? Are they involved?
I won't really say they are involved, or I won't also say they are involved or they are not. But the fact is, our health professionals are the front line when it comes to managing or cautioning people about drug resistance, and they are doing their very best. I must tell you, for instance, there is no medical practitioner out there that will advise you not to complete your treatment plan for a particular antibiotics. So, but once you decide to stop it on your own, it's not their fault. They have done their very best to make sure that you complete your course. That's why once you go to a particular hospital and you are diagnosed of a particular condition, they will tell you to always check back after a certain period of time, after finishing your drugs. But most of all, don't go back to tell them how we are feeling. Maybe we prescribe a particular antibiotics, and that antibiotic was supposed to last for 5 days or 10 days. After 2 days, and your doctor has told you to finish these drugs, then come back for review. But you went home as a normal case would be. At home, you took your drug for 3 days, you felt relieved. Now you have abandoned your drugs. That's not the fault of your clinician. It's not the fault of the doctor. So they have done their best, and they always do their best to give us, to educate us, and they're also educating us, because they will always tell you, make sure you finish your medication. In fact, some of them also go as high as calling you to make sure that some private hospitals will call you to make sure you are on your drugs. They will assign some of their healthcare providers to make sure they follow up to make sure you are taking your drugs. So the healthcare professionals are doing their very best out there. It just come back to us now for us to really listen to them and keep those instructions that they are telling us about these things judiciously.
Okay, thank you very much, Fam David. So, Fam David, how does drugs resistance affect the modern medicine?
It's a very big problem to modern medicine. I can tell you that for sure, because, for example, it jeopardizes the course of treatment of some disease conditions. For example, let's say conditions like maybe you are about to embark on a surgery. After surgery, you need antibiotics to prevent infection. And then you are someone that has a known because of a known drug resistance to most of those molecules that you're supposed to use after your surgery, it makes that treatment to be very risky to come by or to undergo. Then people that are on cancer treatment, then even people that are supposed to undergo organs transplant and they have history of drug resistance, it makes those treatment procedure very dangerous and then risky to come by. So it's a global concern. I must say that it's a global concern that we need to adhere to ensure that we use these drugs, most of these drugs out there as prescribed, then we also make sure that we complete the course of our treatment for us to prevent or reduce the occurrence of drug resistance among us.
Okay, Fam David, thank you very much. So, Fam David, you made mention of antibiotics being a major cause of drug resistance. So, what advice are you giving to us? What's the proper way we should take these antibiotics and anti-malaria drugs?
Okay, my advice is first, adhere to what your prescribers instruct you. For instance, once you are designated to be on a particular drugs for a particular period of time, you should adhere to that. If you are taking a particular drug for, let's say, a 10-day therapy, a 10-day course of medication, you should make sure you follow it strictly. Finish your drug. Whether you are feeling well after 3 days, 4 days, 5 days, you should keep following or taking your drugs to ensure that your 10 days course of therapy is attained. So the first thing is to follow your treatment plan, complete your treatment plan. Then secondly, avoid the misuse and overuse of antibiotics.
Okay.
Then also try to avoid self-prescription, self-medication. Don't prescribe drugs to yourself. Then you should always seek for definitive therapy. You know, what most of us do here is empirical therapy. Maybe you come down with a particular disease condition, maybe infection on your skin, you just jump into the place, mention a particular drugs for yourself. We have not seek any clarity on what is wrong with you. You have not gone to visit your doctor for you to get tested and then some diagnosis should be done medically. You just see that, okay, I'm having this, you now enter and then prescribe drug for yourself. So we should try and avoid self-prescription as much as possible. Once this is done, we are going to reduce the occurrence of drug resistance in our society.
So, Sam David, I would like you to give some advice to medical practitioners too, because I think some of them are also involved in the cause of this drug resistance. Don't you think so?
Well, I would say they are involved because I will always say this: the whole thing comes back to the patient, which is at the receiving end.
Okay.
Because as a medical practitioner, they will always do their best to tell us to take these drugs. They will always tell you this drug has been prescribed for you for so and so number of days, and we are giving you this drug because of so and so condition. But they will do their best. So it's now left for you, the patient, now to make sure that you follow the instruction, and then if need be for you to go back for review, you have to go back for review. But you know, a lot of us don't do that. So I will say this: our medical practitioners are really doing their very best to ensure that we curtail, because they are educating us. Some of them even give us an antibiotic stewardship program, and that is another thing that could help us to reduce the occurrence of drug resistance. But we don't follow it, the patient. So we have to follow their instructions. Take your drug when due. Finish your treatment when due. Because with that now, I can tell you, and I must tell you with my full chest, that once this has been done, we are going to reduce the occurrence of drug resistance in our society.
Okay, thank you very much, Fam David. So, a personal question I would like to ask you: what if we are using a particular antibiotics and it is not giving us the results we wanted, maybe due to drug resistance? Maybe this drug was abused. Should we continue taking it, or we should take another antibiotics, or we should not even take antibiotics at all?
Okay, before I answer your question, this antibiotic, was it prescribed by your doctor?
Okay, yes. Let's just say it was prescribed.
That doesn't answer the question. Was it prescribed? Because that's what I will tell you what to do.
Okay.
If it was prescribed by your doctor, it means you have to go back to your doctor. That's why they always tell you, check us back or come for a visit or come for review after so and so number of days. So that means once you are done taking your drugs and you are still feeling the same, you have to go back for a checkup. That's when they will now diagnose, or that's when they will now run some tests on you again, and then check why you are not getting better. Check whether you are getting better after using that particular antibiotics, for as the case may be. So, but We don't do that most times. And the reason is because most of those drugs are not prescribed by our doctors. Most of those drugs we prescribe for ourselves. You just jump into a community pharmacy, I'm having this, please give me this. And now the advent of Google, everybody just slats out their phone, check what's happening, they just prescribe what they feel is right for themselves. So once these things are caused, we are going to develop resistance. So it's not the fault of our medical practitioners. They are doing their very best. So in your own case, I feel maybe you're the one that prescribed it for yourself, but if it's not, if it was done by the doctor, you have to, after taking your drugs, go back to the hospital and then recheck yourself for proper analysis to be done on you.
Thank you very much, family. You have told us a lot and we have heard about it. So in conclusion, can you summarize what you just said? Like, can you give us few points, some advice that we should follow to stop this drug resistance?
Yeah, of course. Let me start by this. After mentioning what drug resistance is, my major advice is on the public health sector, or is in the public health setting, because drug resistance is a growing concern in the society, that, like I mentioned earlier, and we need to inform people about it. You understand? And that's where most of our health practitioners comes in. They do the role of the front line by educating us to properly use the drugs. So for the case of antibiotics, I think we should use it judiciously, because when we don't use it judiciously, what we are doing is that if you come down with a particular condition, you are going to prolong your hospital stay, and once you prolong your hospital stay, treatment becomes more expensive, and once treatment becomes more expensive, it causes a threat to the general public. You might feel that you are the one going through the condition, but imagine maybe a family of 3 people in the family and you are the one on sick bed. 3 of them will now become concerned or worried, or the remaining 2 people in the family will become worried of what you are going through. So we should use antibiotics judiciously. We should use it as prescribed. We should avoid self-prescription, self-medication as much as possible. Then we should also understand that drug resistance could occur because of us not finishing the course of our treatment. So what does that mean? We should always complete our course of treatment. Then we should also practice hygiene. Yes, because for example, the normal thing like hand washing could prevent the spread of microorganisms. For example, during the Ebola or the COVID time, a lot of us were using face masks, we're washing, and in fact, I remember that time hand sanitizers were very expensive. Like, it was one of the gold mine for a lot of people. But after that eating, you hardly see anybody go out with hand sanitizers lately, because we feel, okay, that was COVID time. But aside that COVID period, if you visit hospitals, once you are back, you should watch yourself, watch your hand, use hand sanitizers, because you don't know what you touch while you're in the hospital. Even at your office, at working environment, you don't know, moving from one desk to another, what you are touching. So you should have your personal hand sanitizer in your car, in your office, and even at home. Because once you do this, you will now limit the spread of these microorganisms. And once you limit the spread of these microorganisms, that means you are reducing the uses of drugs. And once you reduce this, you are not exposing yourself to antimicrobial organisms. Even your personal hygiene, you should also make sure that you adhere to strict personal hygiene. Watch yourself, cut your hair as in case may be, brush your teeth. You understand? So once you put in this habit, we are going to reduce the occurrence of drug resistance in our society. Then you should also use the drug as prescribed, complete the course of your treatment, avoid self-prescription or self-medication. So once you do this, I must tell you, we are going to reduce the occurrence of drug resistance in our society. Then we should talk to people whenever we have the chance.
Okay.
They should always do not collect drug because your friend took this drug and he had a relief of it. You should avoid using someone's drug for a particular condition that the person was going through. Okay. Always visit your doctor to get counsel. They will counsel you and then know what is wrong with you, so they can give you the right treatment for your right condition. So I think once we put this in place, we are going to reduce the occurrence of drug resistance in our society, because it's a very big concern that we need to be worried about.
Okay, thank you very much, Fam David. So we have come to the end of this program. We have heard everything Fam David told us about drug resistance, this meaning, and what you should do, what you and I should do to stop this drugs resistance from happening. Because as he said, you know, go like stay off for hospital for a long time now. You are not just harming yourself, you're harming your families. They are also spending money. The time you should use, maybe you should stay in the hospital for 2 weeks because of drug resistance, you are now staying for 1 month. Money is going. You know how hospitals are expensive these days. Money is going. So if you are prescribed a particular antibiotic, if a particular antibiotic was prescribed to you by your doctor, do as well to finish it. And don't try this self-medication thing. It's not good. Go to your doctor, visit your doctor when you are sick. Thank you very much, Fam David, for today. I really enjoyed your topic. So, and we are down to the end of our podcast show today. Please remember to subscribe and like. And if you have any questions or any topic you would like us to talk about, do well to drop it in the comment section. I'm still your host, Etin Bukben. Stay healthy. Bye.